We got a bunch of Bismarck people, Bowman, Park River, Williston. But there was someone here from Virginia. Did you guys see that earlier?
Yes, yeah.
Yes.
Hi,
This is like
Susanna.
my favorite part of Zoom is like when like what are people's names? Where are they from? And then okay, Rebecca. Hi, Rebecca. Now she's in Fargo, Jamestown, Minot. There's Jesse. Hi, Jesse. I know Jesse. Sweet.
All right, so we're sitting at 12:05. Cheryl, if you want to go ahead and get us started.
Okay. Oh, Cheryl, you're on mute.
I knew that was going to happen. Welcome to NDCPD's Collaboration of Change webinar series. This is the 7th and last webinar in a series of 7. For those of you who have been with us for the past several weeks, we hope you've enjoyed the webinars and the information exchange. We're excited for today's event and hope you enjoy today's presentation. And this is a little information about NDCPD. NDCPD is a University Center of Excellence on Developmental Disabilities, also known as a UCED. And we're part of a national network of 67 UCEDs throughout the United States. We serve the disability community by providing training, technical assistance, service, and information to the disability community. We have approximately 15 to 20 projects at NDCPD that cover a range of topics connected to disabilities, employment, housing, education, and early intervention, to name a few. So please check us out at our website, ndcpd.org, which will also be in the chat. This Collaboration for Change event is a series of 7 one-hour webinars that NDCPD is hosting as an informational exchange on specific disability topics. Today's event is the last one. Each of these webinars includes a presentation from an expert speaker, along with a short presentation from an NDCPD staff member describing our webinar topic, related expertise, and services. With this event, we hope to build a community of individuals and agencies that have common interest in disabilities. So now a couple of housekeeping notes. We will be recording today's events, and the recordings can be found on our website, which will be located in the chat. Please use the chat to ask any questions. We will be monitoring the chat. We do have a short online survey for you to share your comments about today's events. Contact hours are available for both nurses and social workers, and we'll need you to complete that online survey to get the contact hours. The survey link will be provided at the end of today's session and emailed to each participant. With that, I believe we're ready to get started. Today's webinar is titled, "Is it burnout or do I just need a nap? Quality training leads to job retention." And today's presenter is Sarah Troutman. Our NDCPD presenter will be Krista Opsdahl, who will be sharing information about NDCPD's fee-for-service activities. And now we'll turn our attention to our guest speaker, Sarah.
Hi, you guys. Thank you so much for joining me and for everyone here. I am going to share my screen and let me make sure that the view on this is, can you guys see this okay? Yes? Awesome. I decided well, let me give you a little background. My name is Sarah Troutman, and I have been working with individuals with developmental disabilities and also individuals with uh, physical disabilities and just within the disability community for the last 27 years. And when I initially started doing this work as an undergrad student at Gonzaga University, I worked a lot with folks that are in the geriatric population, but also had developmental disabilities, many of whom had been institutionalized at certain points in their lives. When I went to graduate school, my emphasis was working with teens and adults, and working with adults has especially always been my like greatest passion. But as I decided to open my own behavioral health company, the focus that we had for many years was around early intervention and school-aged children, mostly individuals that have autism spectrum disorder. And I founded a company in the San Francisco Bay Area in, oh my gosh, I think it was 2004, that I ran for 15 years. And I sold and exited that company about 5 years ago. And so most of the focus of my work in this kind of like second phase of my career has been around supporting the folks that provide services for individuals with disabilities. I'm a board certified behavior analyst by trade. I've been a BCBA for 20 years. As I am saying these numbers of years that I've been in the field, I'm just like, no wonder I had to cover up my gray hairs this morning because I've been here for a while. And there's nothing else that I can really think of that I would rather be doing than supporting both the individuals that provide services for folks with disabilities, and also ensuring that any services that are provided to the disability community are done with the focus of wanting to help the recipients of service live their best lives. I mean, you know, life is short. Every day that we get to spend here is a gift. And I think being able to work in community with each other to support everyone, irrespective of their, you know, disability or any other variable, to be able to live a life that is meaningful to them is work worth doing. And I think it's also, you know, a huge part of what makes us like a connected community to each other. And that's just a little bit about me. Okay, so this is my presentation style. I am casual, but also I am a middle-aged mom, so there's only so many things that I can do at once. So this is what I'm going to do. I have some slides for you guys, and I'll kind of walk you through them just to be able to provide a lot of context. But if you guys have questions in the chat, someone else is monitoring that because I don't have enough brains to both monitor the chat and do my presentation at the same time. So throw a question up in the chat, and then one of the ladies on here will just interrupt me if it's something that I can address immediately. And I want this to be kind of like conversational, because A, I get very tired of listening to my own voice all the time, and B, I have prepared information that I think is helpful, but I would never assume that I know everyone in this audience. We have, you know, over 80 people right now on this call, all of whom I have never met before. So if there's something that you want to talk about or a question that you have, let's get into it. And so I really wanted to, you know, focus this presentation on the case for investing in quality training as a staff retention strategy. And I'm going to kind of paint a picture around burnout and some variables that impact that, tie this with the impact that quality training can have on individuals that are providing any type of health or human service, and then really talk about what does it actually mean to do that. And so as someone who is in the behavior analytic community, as I said, I've been certified for 20 years. All of the information that I want to share in terms of like the context around kind of burnout and the case for training is really based on data from within my field. But I also do a lot of reading and research around other allied disciplines. And so while, you know, some of these numbers may not like be kind of like contextual for maybe specifically what you're doing, the issues that have been occurring in behavior analysis and more broadly in kind of health and human services and healthcare in general, they're the same. Some of the details are a little bit different, but the trends around burnout and kind of turnover in behavior analysis very much mirrors other allied disciplines, whether that's social work, marriage and family therapy, speech pathology, occupational therapy. So this is definitely, you know, I think usable for a larger audience, which it sounds like we have here today. But again, as this is my discipline, I just wanted to give you guys some context and some perspective in terms of how I have been approaching burnout and training as it relates to staff retention. And again, I welcome your questions. So to give all of you guys some information, as of January 2nd of this year, these are the amount of board certified individuals that exist in the planet. And so to kind of contextualize this even more, right now there are 66,339 BCBAs worldwide. And I have been certified for 20 years, and I was the 1,642nd certificant. So I like to tell people that I am from the Jurassic period of behavior analysis. So here's the number of certificates, BCBAs, which are most people like me that are in, kind of like clinical supervisory roles. BCABAs are folks that can work under a BCBA, but that can't practice independently. And RBTs stand for registered behavior technicians. And so these would likely be kind of a similar position to maybe like a DSP worker, but it's kind of more of the direct therapist. So in the behavior analytics space, similar to, social work, again, speech pathology, you have clinicians and then you have a lot of direct service providers. And that is a pretty typical model that we see in Health and Human Services. But in behavior analysis, what's really interesting is the growth rate of this profession specifically. And I love trivia and information. So I will ask you guys, and here I'm going to open the chat just so I can see this for everybody. Do you guys know why, if you look at this, kind of chart, these are all based on the number of job postings nationwide for behavior analysts. And there have been, this like incredible increase over the last like 13 years. If anyone wants to throw in the chat why you think there might have been such a kind of like surge in number of job postings nationwide for behavior analysts over the last 13 years. Like, where are these numbers coming from? Like, it used to be 789 if you look at that first number. And now, as of 2022, there were 57,569. Why? I'll wait till someone throws up an answer. Awesome. So the realization, Medicaid reimbursement, Chris and Hillary, spot on. This trend is absolutely and 1,000% related to the passage of autism health insurance mandates in every state in the country. The last state to pass an autism health insurance mandate was Tennessee, and that was in 2019. And to Chris Deaver's point, also because Medicaid reimburses for ABA services for individuals with autism. Yes, so there has been an incredible increase in the demand for behavior analytics services, specifically for folks with autism spectrum disorder, because that has been aligned with legislation and funding. And so this, for someone like me, where I started my career working within the school district system, which I think a lot of you guys do, and also with the Department of Developmental Disabilities, when the autism health insurance law passed in California, which is where I lived for 23 years, this changed everything. Because if you guys are familiar with IDEA, which is the Individuals with Disabilities Education Act, which is the federal law that governs how special education services are provided in the United States, which compels public school districts to provide FAPE, a free and appropriate public education, to individuals that have an IEP and are in special education. But that is just, the education mandate is it's an access, like a floor, meaning like, hey, we want to make sure that you can access your education. So what are the supports that we need to provide within the context of the IEP in order for you to do this? Versus when you had autism health insurance laws passed, this was a medical necessity mandate, which means this is like the ceiling. So for me in my practice, there used to be a lot of guardrails and restrictions around how many hours kids could get, how long children could receive services that were not necessarily tied to their progress or their own individual needs. But autism health insurance mandates changed this and really allowed there to be a lot more latitude given to providers. And as long as you could show a medical necessity, make a medical necessity argument for the dosage and treatment plan, then these hours would be authorized. And these services have largely been covered almost completely for a lot of families, especially if families have Medicaid or they have a commercial plan that is a primary plan and then Medicaid as a secondary plan. So people were like, this is great, awesome. And now there is this huge increase in the demand for services. But just like with every other profession, more demand equals more problems. And I wanted to give you guys some, I think, very interesting demographic information from behavior analysis, which I think is incredibly helpful. And I'll actually, given this audience, I'll give you guys a little bit of comparative data from other helping professions. So this is a graph that represents the ages of behavior analytic professionals. So this includes BCBAs, so like the clinicians, like someone like a social worker, MFT, and it also includes the registered behavior technicians, which again would be more like of a direct service provider. And if you look at how these age demographics break out, you will see that for my profession, 45% of folks are between the ages of 25 and 34. And the second largest percentage are folks between the ages of 18 and 24. And for most direct service professions, usually the kind of floor of education is a high school diploma. And that is the same with the registered behavior technician credential. You have to have a high school diploma in order to obtain that. But what this means is you have almost you have about 66% of this entire field are people from the ages of 18 to 34 years old. Comparatively, if you look at national statistics for psychologists, psychiatrists, and marriage and family therapists, the average age of those professionals are 42 or 43. Which means that they are in this, kind of 35 to 44-year-old demographic. Or if you're me, I'm actually in the 45 to 54-year-old demographic, which only represents 9% of the total industry or field of behavior analysis. Why am I obsessing over age? I will tell you, and this very much links to training. And again, I think likely is the kind of the same, challenges that we see in other allied professions, whether that is, Department of Developmental Disabilities, respite workers, or school. Most people that are providing behavior analytics services are very young. And most of these folks are very early in their careers. A large percentage of these people are also folks that have a high school diploma and may have not had any college or graduate training in behavior analysis. And the percentage of people that would maybe be considered mid to late career, which I define as 45 years or older, is actually, I think, what is that, 9.3, about 13%. So this means that you have, if you remember that slide I just showed you, huge demand for behavior analytic services. You have a very, very young workforce that is, early in their career. A huge portion of this workforce are also folks that may have never come in contact with specialized training previous to obtaining these jobs in areas like developmental psychology, behavior analysis, IEP, special education, anything. And so this has created in behavior analysis, I would say, a perfect storm of exhaustion, stress, burnout, and people have had a really challenging time trying to figure out what is going on, and more importantly, what do we do about it? And so I was running an organization, Defy, and we were really interested in just getting more data and information and more clarity from my industry to kind of figure out what is happening. People seem really stressed out. They don't like their job. The turnover rate in behavior analysis is really high. The turnover rate in health and human services and disability services in general is exceptionally high. So how can we better understand this? So we created a behavior analyst burnout assessment tool, and we created this tool by using previously validated assessments from like organizational and industrial psychology. And we crosswalked it for our purposes into more behavior analytic terminology to make it a little more systematic, because that is like the standard for behavior analysis. But the great thing is when we put this out to the, kind of general behavior analytic community, we had over 1,616 people participate, and we collected very large amounts of demographic data on every single participant. So we knew what our sample size was made of, and our demographic data showed us that we had a great sample size because we had people from that were newly certified, have been certified 5 years, 10 years, people from all different types of positions, whether those were school districts, those were private companies, those were community-based companies. So we had a really like large cross section of our total population. We also asked data around gender and race, and we found that our data very closely mirrored the Behavior Analyst Certification Board data. To no surprise of anyone on this call right now, a lot of folks that are working in the disability communities are women. Just look at like all of the people's faces you can see right now, we're all ladies. And so we had, again, like a really, really strong and I think validated sample set according to our certification standards. So we feel that this data is very accurate, and that's really important. And I want to share some of the findings of this data because I believe that these kind of 4 quadrants really represent a lot of challenges in health and human services in general, which is why when, I was talking about doing this presentation, I love the idea of like, is it burnout or do you need a nap? So let's talk about this. So if you see on the top left quadrant, it says it's the Oldenburg burnout inventory. And that is, again, that's a validated tool that was created. I love the Oldenburg burnout inventory. And this measures exhaustion. And so these are, of course, the questions that people had to answer. They basically there's like a Likert scale of, hey, do you agree with the statement? Or, do you disagree with it? Do you strongly agree? Do you strongly disagree? And what we found in our data is one of the questions we asked was, after work, I usually feel worn out and weary. And so our data, according to the over 1,600 participants that we had, 42.7% agreed, 25% strongly agreed. If you look at the lower left quadrant, the question was, I take some time for relaxation each day. And this was using the self-care assessment that was evaluating life balance. And so there was definitely, about 28.9% of folks agreed, but the disagreed and strongly disagreed was almost 50%. If you look at the upper right quadrant, the question was, I avoid overcommitment to work responsibilities. And again, that was part of the self-care assessment and life balance. And that data was very overwhelming. So we had, 67% of folks disagreed or strongly disagreed that they avoided overcommitment in their work responsibilities. And in the lower right quadrant, you see, I take breaks throughout the workday. You can't see the rest of that statement, but the statement was, I take breaks throughout the workday when I need them. And again, you have some percentage of folks that agree and strongly agreed, but a larger percentage that disagreed or strongly disagreed. And I think that this data is really important because if you look at other data that evaluates kind of like burnout and stress, both in the medical industry, specifically nursing has some really, really great data that they published. The American Medical Association, actually the United States Surgeon General, one of the biggest factors that they are focusing on for the next 10 years is the well-being of doctors, because there is going to be a shortage of primary care physicians in the United States over the next 8 years. The shortage could be anywhere from 30,000 to 120,000 doctors that will not be entering the field because the medical profession can be so demanding. This data is also very similar to research that's been done in the social work space, marriage and family therapy space. And I think that there are a number of reasons why we see this. But first, I'm going to open the chat again. And I would love to know from you guys, what do you think might be some of the variables that are impacting this, kind of overall sentiment, at least in, not just in behavior analysis, but really in health and human services and healthcare in general, when people are just so, like, they're so tired. They're worn out. Like, what are the variables that are impacting this? And you can just kind of throw it up there. Or you can even talk about what the variables that impact you. Yes, staffing shortages, 5,000%, large caseloads, lack of support. Yes. The staffing shortages, lack of consistent training, no real break from important work. I mean, anyone that's working in any kind of helping industry, you have like exposure to secondary and primary trauma all the time, increasing administrative tasks, regulation, influx of clients, constant fires, 5,010%. Absolutely. And years of working without a break. All of those things. So I think that's the real challenge in helping professions and in medical professions. There are constant pressures and kind of changing demands, regulations, and especially for those of us that are getting reimbursement either through Medicaid, commercial insurance, or other government funding. This often requires a tremendous amount of like admin, oversight. There's compliance, there's reporting. And so for most people that I talk to that work within the disability community, if you ask someone like, hey, why did you go into this work? Likely they're going to say, because like I want to help people and I want to do something that matters. I was no different. I initially, when I started school, I was like, I'm going to be an attorney and just like, build $900 an hour and like live on a yacht. And then I realized that like that seemed pretty empty to me. And when I got into behavior analysis, it made so much sense to me. And I really loved the impact that I could have. But I think the challenge for us, especially since this is generally largely female-driven field, and we are working within kind of constantly changing goalposts and very, very intensive staff shortages, which are not going to be going away anytime soon. The education and healthcare sector in the United States are rapidly growing. There are ample jobs in both of these sectors, but there are, as you guys have all articulated and likely experienced on a daily basis, there are never enough people to do these jobs. Why is this? Part of this one is because depending on where you work and the type of work that you're doing, these jobs have historically been paid less. It's been very clear. And I think in terms of like our values in the United States, in terms of like where we assign value and what we pay for certain types of work. As I stated when I started this presentation, my focus and, first love has always been working in the adult population, but reimbursement for adult services is often very challenging comparative to reimbursement for early intervention for autism, for example, because adult services, these are generally services that folks need to have through their lifetime. And so it becomes very expensive to do this. And so as, we have challenges around reimbursement, as there are, kind of like fairly low minimum standards for people to enter into certain types of jobs, as all of us like that are either supervisors, clinicians, have kind of like constant change in terms of kind of regulations, reporting requirements, and other kind of contractual obligations. This just creates such a stressful environment. And then finally, for women, especially in American culture, we have often been socialized to look at the value of what we do as it relates to what we do for others. And so there are a lot of kind of insidious narratives and sometimes like very overt narratives that if you are not doing all the time for other people, that means that you are a bad person or you are not being effective at your job, or you know, you don't really care. And so what I would like to kind of encourage all of us to consider is really kind of flipping the script on its head. And what I talk about a lot in the presentations that I have is, if what your values are as a person is you want to be an effective service provider, regardless of what you're doing and what type of services those are. And if you want to be able to do this for the long term, then you have to start taking care of yourself, and you have to prioritize your well-being, because if you look at studies from the American Medical Association and from a lot of different kind of hospital systems throughout the US, what the AMA has learned is, gosh, when we have physicians or nurses or other medical practitioners that are, you know, running on fumes, they haven't been sleeping, they're not getting enough, you know, maybe like nutrition, rest, etc., then these are folks that are having higher rates of medical errors. And not because they are trying to make mistakes, but because their brain and their bodies, their emotional, mental, and kind of like physical states are so worn out, then they're making errors. And when that happens in certain medical professions, people die. And so the AMA, the US Surgeon General, has put a lot more emphasis on how do we create and cultivate more well-being for our medical professionals in service to making sure that we are providing optimal medical care for, you know, our population of Americans. But I think in health and human services professions, there's not been as much discussion around like, how do we do this better together? And I think there's often, you know, I don't know if you guys have ever been in meetings where like the kind of like, you know, headline for the meeting is like, we're just going to have to do more with less, which means that we're asking you to do more with less. Like, we're understaffed, we're underpaid. And that can feel really defeating. But I think that there are some very specific things that have been shown that are evidence-based and also, I think, just pragmatic, that can really help this piece. And so I really want to focus on the training piece, because this is, you know, to me, a huge piece of how we can do this better together, to help continue to elevate all of the types of work that we do, and to continue to support the folks that are doing the work in order to ensure that the recipients of that work really are getting, you know, the care, clinical support that they need in order to like live their best lives. I am a subscriber to the Harvard Business Review. I don't know, do any of you guys subscribe to Harvard Business Review? I'm waiting for the chat for anyone to say. No. Okay, cool. Well, guess what? Yeah, some of you guys do. You don't have to subscribe, because I'll share this article. Actually, you can get it for free now. But I love the Harvard Business Review. Not just because, you know, anytime you say Harvard, then you feel like you're like elevating your presentation. Like, well, like I said, like if it's the Harvard Business Review, it must be true. But I think they do an exceptional job in terms of their articles and reporting, to really have a robust view of kind of issues or problems that they're highlighting. And so this article was published about 2 years ago. And it talks about 3 ways to boost retention through professional development. And I'm not going to walk you through this entire article, but I did want to highlight a key piece of this. And this is the source, by the way, if you guys wanted, this is the link at the bottom. And again, if you pop in this link, you can get this article free. There should be no gatekeeping behind that. And so here's something that's really important. Quality training is good for business. So this article cited a survey from Better Buys that found that employees who get professional development opportunities are 15% more engaged and have 34% higher retention than those that don't. Also, there are some great statistics from Deloitte, which is a huge consulting agency that's been around forever, that works with all different types of industries. And they said that organizations with a strong learning culture are 92% more likely to develop novel products and processes, 52% more productive, 56% more likely to be the first to market with products and services, 17% more profitable, and their engagement and retention rates are also 30 to 50% higher. So this is a pretty compelling argument for investing in training. But this is where I want to get very specific in terms of the type of work that we do. When we talk about investing in quality training, I think there is often a lack of understanding that quality training, and I would even go further than saying effective quality and efficient quality training needs to be done at all levels in all levels and all kind of components based on the type of work that you're doing. If you're in a clinical role, which I think a lot of you are, especially like, for example, in behavior analysis, there has been, from my perspective, an overtraining around like clinical pieces of the job that we do, but undertraining around systems pieces. And this is where I'm hoping that I can really make a very compelling argument to all of you guys that are in positions where you have some type of control over kind of training budgets, how you do training, what type of training that you're doing. If you think back to the slides that I shared with you about the demographic data for behavior analysts right now and other behavior professionals, and if we are looking at the vast majority of people in my profession being 34 years or younger, these means that these people are likely early in their career. And again, if they're in that kind of like RBT, registered behavior technician category, the minimum standard to become an RBT is a high school diploma. So theoretically, you have folks that are working with complex populations with a lot of different needs that have maybe had no prior exposure to these populations, again, that have not had, college or graduate training coursework in, development, psychology, sociology, behavior analysis, et cetera. And so I don't know if you guys get this, but when we have people that are kind of like fresh into whatever kind of work that we're doing, similar to, my deer in the headlights when I was driving from Garrison back to Bismarck, like, do you guys just have people that are coming in and they're hired and you wonder like, hey, are you hired simply because you have no criminal record and a pulse? And then because they look like just a terror, just a look of terror on their face, like on their first days. Like, can anyone else relate to this? And like, throw that up in the chat. Like, where did you come from? And they have no idea what they're doing. Have you had this experience? Or are you working with people that's literally who they are in your organization? Yes. See it frequently. Yes. Yes. Yeah. Because when we are in like when we're service providers where there are kind of like, fairly minimum standards for people to kind of enter into our field, again, like high school diploma for registered behavior technicians. There's a master's level requirement for board certified behavior analysts, but I don't know if you guys know this or not. But if you're a board certified behavior analyst like myself, there are no requirements to have any type of subspecialty in specific populations that you work with. So, I mean, I've been working with folks with autism for, over 20 years. I was not required to take any additional coursework on that. And we also, in the United States, all of our health insurance mandates that have been passed in all of 50 states all tie reimbursement for these services to the behavior analyst credential. So that means that, hey, I just obtained, my BCBA like yesterday, and that is a minimum standard credential. But now, because of how the legislation has been passed, I can, in theory, be reimbursed for my services. I'm allowed to support all of like the direct therapists in my services, but I may have never been have done any kind of like independent practice. There is of course a fieldwork requirement component for the behavior analyst credential, just like there are in every other industry. But this just means like it's a floor of competency, not a ceiling. And in an area like behavior analysis, where you have almost everyone is starting at the floor, and you don't have a lot of folks that are available that are more mid or late career, this has created incredible strain. And it means that people are taking these jobs, and I'm sure this is, the same for you guys too, regardless of where you're working. You're bringing folks in to do this work because, gosh, we got to get some more people to do this. And they don't have any idea what they're doing. They know it. They want to do good work, but they are terrified. Often, depending on the organizations that we work in, we don't have a lot of room for asking questions or making mistakes, or people feel like they shouldn't do that. Like, oh, well, they hired me to do this job, so I should just figure it out. But all of us know that, the only way to figure it out is to try. And the only way to figure it out is to be trained. And so investing in both the clinical training, like the how do we do this type of work piece, and how do we do this type of work within the systems that we need to work with to function, is, from my perspective, and also based on data, that is the holy grail. I don't care if you are an exceptional behavior analyst and you can write a really good treatment plan. If you don't know how to manage and understand the electronic health record that you're working in, if you don't know how to manage the time and attendance system, if you don't know how to manage your calendar, or to make sure that you are consistently evaluating your staff, then you actually don't know how to work within the system that you need to do your job. And this is where, I think a lot of people try to cut corners, is by thinking, oh, if I just give you the clinical training on the how do you do, this specific type of work piece, but I don't train you on how do you do this work within the context of the system, that's when things start to break down. And if you look at burnout, the whole idea of burnout started really within the medical field. This has been something that's been articulated by the World Health Organization, the International Classification of Diseases. You can be diagnosed with burnout. It's a professional diagnosis, but burnout occurs like at 3 different levels. You have burnout that is related to individuals. So maybe there are specific factors or other variables for you as an individual practitioner. But then you have burnout and stress that occurs at the level of the organization. Again, if you are, an exceptional clinician and you can get in and do a great job during like rounds, or when you have, direct treatment, but your organization doesn't support you or help you to understand, where do you put this information? What are you responsible for in terms of supervision? Are there hourly requirements that you have? How do you manage them and track them? Then you can get very burned out because the organization itself isn't supporting the success of your work. And then this final layer of burnout is really at the systemic level. So for example, like the United States healthcare system is whack. I have another 4-letter word I could use for it, but I feel like you guys are a nice group of folks, so I'm not going to. But our healthcare system is screwed. I mean, there's no other way to put it. We're not in the business of keeping people healthy. We're in the business of keeping people sick. The United States spends more per capita on healthcare than any other country in the world, and we do not have optimal outcomes. In fact, our outcomes are terrible. And if you are a person that is on this presentation right now and you have a disability, you also know that if you have a disability, if you are someone that is a member of a minority group, or there are other variables, your health outcomes are even worse. And that is ridiculous, and I don't accept it. And it pisses me off. And I know at the systemic level, I can't write a letter tomorrow to Congress to be like, hey, you guys are shitting the bed on this, and I'm pissed, and we need to do a better job. So why don't you start something better tomorrow? That's not how that works. There needs to be legislation, advocacy for systems change. But for all of us right now that are in our jobs right now, that want to support the folks that we are doing the work for right now, we really need to focus on the organizational supports and how do we support each of our own individual needs. And that's really been where the focus of my work is, because the system piece absolutely needs to change, but that is a much larger, broader, and lengthier conversation. But at the organizational and individual level, really focusing in on exceptional clinical training and systems training, so people have the tools that they need to do their jobs, but they know how to use the tools. And let me just give a couple examples of what isn't good training, because this is where the technology of teaching really comes into play. Many people think that good training is simply giving you a link for a video for you to watch about something that you are supposed to do. So if you have an electronic health record system or some other kind of like system where you have to like input hours or write notes or whatever, there are many organizations that will be like, hey, welcome aboard. So glad you're here. Here are 97,000 links of things that you need to watch, you know, in the next 4 minutes. And we're expecting you to retain all of this information and know how to do your job. Thank you so much for being here, and make sure that you know how to do this tomorrow. Have you guys had any, like, have all of you guys had experiences where your training basically consisted of just like links being sent to you and then you were just like left to your own devices? And I'm asking this question so then I can take a drink of my water. Yes. Yes. So what I would really, yes, sweet. What I would really challenge you guys to think about when you are looking at training is, one, consider breaking training into smaller components. Over time, you will get greater retention. A lot of times people like want to front end training, like, hey, you're new here, so we're going to like blast you with like 50 hours of stuff. Typically people retain about like 8 to 10% of information when they have a lot of things that they're front loaded with. And the key here, and this is where anyone that's in this presentation that's a behavior analyst knows that this is like the make or break thing, is how do you make sure that you are training for fluency and competency and generalization? Meaning that if there are specific things that you need people to do as clinical components of their job or systems components of their job, how can you make sure that whatever training that you're providing for them, that you can evaluate their skills to make sure that they know how to do it well, and that they can generalize this to other, you know, parts of their job if necessary, and they can regularly demonstrate this skill, because you don't have any skill, whether it's a clinical or system skill, unless you can demonstrate it all the time. And the awesome thing about great training, and for those of us that have been doing our type of work for a long time, and why training really helps us retain folks, is because the more that you can build fluency, and the more that you can recruit the types of skills that you need to do your job, the less effort it takes you to do your job. This is why you will have people, you know, like there'll be, you know, something will happen at a clinic or at a community-based center or a school. And like the younger folks, I don't know if you guys have seen this, like everyone is like freaking out. They're like, oh my God, this is a crisis. And for those of us that have been doing this for 27 years, I am not freaking out. Why? One, because this is not the first time I've seen it. Two, because I have skilled and fluency on what to do about it. So I don't have the same amount of emotional effort that I'm putting forth in order to solve this problem. I don't have the same amount of mental effort that I have to put forth in order to save this problem. And so I can stay in a more kind of like neutral area as like internally to be able to respond appropriately, to be able to help people do the things that they need to do to solve this problem. And that's why quality training, effective training is so important. We need to help all of the folks, irrespective of where they are when they come to us. We want to help them continue build fluency, generalization, all across everything they have to do, the clinical piece and the systems piece. So whatever their job is, they can build confidence in it and they can build fluency in it to make it easier for them. And if we are continuously doing this and we're always offering opportunities for people to learn more, and that we are actually making sure that they can demonstrate these competencies to us, this makes people feel so great. And it makes it a lot easier to deal with maybe some of the staffing shortages or other stressors that we have less control over if we feel like on a daily basis we can show up in the jobs that we're doing, and for the most part we got it, and if we don't, we know who to ask, and if we need extra support and training, we can get it. And this is why, you know, quality training is just such an important piece of what we do, and it's also the right thing to do. What message are we sending to the communities that we serve if we're just kind of like letting anybody do the job and we're just like, no, well, hopefully they'll figure it out? That doesn't send the message and clarify that, gosh, we really value the recipients of the services that we provide. What does send the message is when we are vigilant and always looking for continuous improvement and really trying to train folks to be exceptional clinicians, to be exceptional service providers in service to providing exceptional services for the recipients that we work for. And I'm looking at the time and I'm going to stop talking. But I hope this has been helpful. And if nothing else, that you recognize that, like, you guys are doing a great job. We need you in the work that you do. You also got to take a break sometimes, but really focusing on how do we support each other through training, especially for folks that are coming in. That's going to be a massive key for us to all be able to have less stress, but also to really retain the folks that are doing the great work that you're doing. Thank you.
Okay, we are going to turn it over to Kristen now.
Thank you so much, Sarah. If you guys have any questions, please feel free to add it into the chat, and I'm sure Sarah will gladly answer any questions that come about. Can you guys see my screen okay? You guys can see the presentation mode?
Yes.
Okay, perfect. Thank you. So I'm Krista Opsedal, and I'm filling in for Michelle Burney. She is our fee-for-service specialist who helps coordinate some of our fee-for-service activities, and she's out today, so I'm just filling in for her. So to start off, we're really excited about some of the things that NDCPD employees do. We do have some of the best and the brightest expert professionals in the field, and we want to share that expertise with you. For those of you who've had the opportunity to join us for most of the presentations throughout this webinar series, a lot of these training options probably look familiar, such as our BCBA services, our ECHO trainings, our customized employment, and so on. But we also want to talk about some of the broader things that we can provide for technical assistance. So in addition to the training and consultation services, we do have extensive experience in providing technical assistance in a wide range of areas. And we'd look forward to having an opportunity to collaborate with you if you have any technical assistance needs that you may need or you may have. This includes housing, disability awareness, Medicare fraud, and we also have Safe Talk suicide awareness and many, many more, but here's some of just the main things that we can offer. So just to wrap up, why partner with NDCPD to address your training needs? Whether you're seeking specialized training for your team, speakers, or if you need expert speakers to educate your community, or personalized consultation and technical assistance, we've got you covered here at NDCPD. So join us in our mission to provide service, education, and research, which empowers communities to welcome, value, and support diverse people of all abilities to advance self-determination, and inclusion throughout the lifespan. If you're interested in contracting with us, feel free to reach out to Michelle Burney, and Christine just put her information in the chat. And we really hope that you guys enjoyed this series. I'll go ahead and pass it over to Cheryl Merck to wrap us up.
Thank you, Krista. Thank you, Sarah, for the great presentation. It was a lot of great information that you shared with us. Now we'll take a few minutes for questions and answers. If anybody has any questions, please put them in the chat or else unmute and we'll try to get those answered for you.
Nothing's in the chat.
Okay. We'll give it just a few more seconds and see if there's any questions.
And also, just so you guys know, I have a bunch of resources that I'll email and make sure that Susie can email them to you later. There's my presentation, which, I mean, whatever, I don't know that that's a resource, but I have like great articles that I think are really helpful. So I'll give them all to you as like a little bundle from me.
Thank you